We're going to be talking about malaria infection and how it's a public health hazard. Malaria infection starts by a mosquito bite, especially a mosquito that has been infected with a malaria parasite. More specifically, those female Anopheles mosquitoes, when they attempt to draw its blood meal from a healthy host, some of those parasites present in the guts of the mosquito get inside the host and then infects it. One common and known species to be most virulent is the P. falciparum parasite. The disease is known to have evolved in Africa and then spread to other regions like Mexico, Central America, and Europe. Also, these female Anopheles mosquitoes are most active and common in warm and humid atmospheres, such as the tropical rainforest atmosphere, and those areas rich in agriculture. Among the disease precursors or the etiological factors that increase the risk of malaria infection is previous exposure to microbial infection, also inadequate feeding and poor sanitation and proximity to mosquito breeding sites are all factors that increase the chance that a person can get a malaria infection. Those who are at risk of HIV and can possibly develop AIDS in the future are also at risk, as well as young children who have not developed their protective immunity yet. The heavy use of pesticides in nowadays culture is very dangerous in that it can possibly lead to evolution of new resistant strains that can complicate treatment and lead to a high chance of disease relapse. How to solve the problem? Well, there's currently a certain type of therapy called the ACT, which depends on the combined use of drugs such as chloroquine and permaquine, and as well as other anti-malaria drugs. And these are known to act by reducing the biomass of the parasite inside the host, by clearing out and inhibiting its reproductive cycles. This would require prior testing and screening, as well as obtaining of blood samples and running them for malaria infection or like presence of parasites. Also, part of its success has depended on the early detection of the infection, where it's better to detect the parasite in its early stages of development in order to better utilize those type of drugs. The use of long insecticidal nets has also been proven to be a very effective form of treatment, as they act more on the vector control side, where they create a barrier between the host and the mosquito, while attempting to kill those parasites or kill those infected mosquitoes thanks to the chemical repellents present in the fibers of those nets. Solving the problem. In countries like Africa, there has been an approach called the integrated vector management approach, and this highly discourages the use of chemicals, while it highly encourages the cooperative effort of the community and raising awareness and acknowledging people of all the sort of preventive measures out there, as well as how to detect or what to look out for to detect malaria early. This has also depended on the use of or the cleaning of mosquito breeding sites, as well as improvement of sanitation. Those are really important in the fight against malaria infection. Public health in the future. One common treatment protocol that is highly recommended by the Centers for Disease Control as well as the World Health Organization is the use of the combined use of drugs such as chloroquine and permaquine, as we talked about in the last slide. Also, follow up with the patient through a telephone call or a house visit is highly recommended. While during those visits, one should be tested for his blood sample, and his blood sample then run for molecular diagnosis for malaria parasites. Another drug that is currently under development and has proven to be very as effective as permaquine is tafenoquine, which is prescribed at a single dose, and it's known to be more long-acting and is prescribed at a single dose compared to permaquine, which is prescribed for 14 days at a 15 milligram tablet dose. Public health in the future. Well, all those preventive measures that we previously discussed in the previous slides has proven to be very effective in treating malaria. However, If we were able to inhibit this cycle or the chain of infection as displayed here on the slide in its early stages by means of vector control or controlling the Plasmodium parasite, that would prove to be really helpful in avoiding contact with the humans and avoiding the entry of the parasite inside the humans. This would allow for more effective treatments and better means of treatment. Also, education, extending education to those countries and regions that are in lack is also very useful, while abstaining from the use of chemicals such as DDT would allow for a better and more effective treatment in the future. Thank you.